Students, today I am going to explain you about the practical structure of PT Ortho, how it is going to be. Okay, so during your holiday time, you can mentally and practically prepare yourself by knowing the structure of PT Ortho exam, how it is going to be. Okay, coming to the examination, you will have two examiners, internal and external examiner. With both of them, you will have the same structure. Okay, so the practical exam is going to be for half an hour, 30 minutes. Okay, now the moment you come to the examiner, you will be given the practical question. The practical question will be in the form of scenario or a clinical condition. If it is a scenario, whether it is scenario or a clinical condition, you are going to identify the common problem list for the question given to you, and based on that you have to prepare the physiotherapy aim and long-term goal, short-term goal, and the appropriate outcome measures to check the treatment and exact treatment modality, what has to be given to the patient, and then home exercise program, do's and don'ts, and finally you have to fix up the follow-up when it is going to be. So all these things you have to plan. For this, you will be given a blank sheet and you will be given 10 minutes time to prepare and plan the performance, practical performance, so that when you prepare the plan, when you plan and prepare the whole scenario, your whole performance, then you come to the practical exam and perform. The performance will be uninterrupted and it will be smooth and efficient. That is why the preparation time is given to you. So during the preparation time, you have to plan everything as if you give answer for a theory question. You have to prepare the answer, but the answer need not to be very detailed. It should be very abbreviated form. In abbreviated form, in a short note, like a short notes, you can write it. Need not to be very detailed, because the notes is going to be used only to perform in the practical examination, not to explain you, not to convince the examiner that you know the answer, the whole answer of the particular answer for the particular clinical scenario. Okay, it can be very short and precise, which should be helpful for your performance. That's it. After that, when you come to the examiner will ask you to perform the whole skill which is relevant for the case in a given case scenario. Then you have to start performance. For this performance, practical performance, every student will be given 20 minutes. Okay, that 20 minutes you can split into 4 parts, 5 5 5 5, like 4 5 minutes. In the first 5 minutes, what you have to do is you have to welcome the patient, and then check for any general contraindications or precautions relevant for the case scenario and the treatment what you are going to give generally. And then you can perform, is there any special test necessary to confirm the clinical problem, you can perform those special tests. And also you can perform the pre-intervention outcome measure. The outcome measure is actually you are planning, already you have planned according to the problem, patient problem, and also what kind of treatment you are going to give. Accordingly, you know what outcome measure will be relevant to check the efficiency of your treatment. Those outcome measures you have to check. It may be pain, range of motion, function, something like that. Those scales you have to perform and record the findings. Then you have to start. So first 5 minutes over. In the second 5 minutes, you are going to start the treatment skill. Basically, you will have to perform 2 techniques. Okay, 2 treatment techniques. So basically, ideally it can be one exercise therapy type of technique, one electrotherapy type of technique will be ideal. So first technique, maybe exercise therapy or electrotherapy, it's up to you, up to your choice and justification. You have to select and do. For that, initially, before you perform the technique, check for local contraindications, precautions, and then perform the technique. For that 5 minutes, you can take time 5 minutes. Third 5 minute, now first 5 minute over for the receiving the patient and checking the general contraindications, precautions, and performing special test, and also to perform the pre-intervention outcome measure. The second 5 minutes, checking the local contraindications, treatment technique 1 is over. Third 5 minutes, again checking the local contraindication, treatment technique 2. So this local contraindication is specific for the treatment technique number 2. So 5 minutes over. Last 5 minutes you are going to do the post intervention outcome measure. Again you are going to check the outcome measure in order to know the efficiency of your treatment. How much improvement has been achieved, treatment improvement has been achieved. Then you are going to teach the patient what are the do's and don'ts that should be followed at home. Okay, so do's. So those instructions will help the problem to recover fastly, and don'ts will help the patient not to aggravate the problem. Okay, and along with do's and don'ts, you also have to very clearly explain and teach home exercise program. So set of exercises you have to frame already. So you have already planned it, so that you are going to teach here. Basically the home exercise program will be with or without some object related exercises. Mostly it will be free exercises. Sometimes mild resisted exercises with using home related objects like water bottle, sandbag, like that. And along with that you can also teach some functional exercises which are very relevant for the given case scenario, so that the treatment progression will be more better. So like this you have to treat. And finally fix up the next appointment, whether it is going to be every day or alternate days or once in a week, like that. So you basically have all 20 minutes time to perform all these things, from receiving the patient to fixing up the next appointment, 20 minutes time. And after that the practical part is over. And after that you will have a 10 minutes of oral examination, where the examiner will ask you few questions, basically to check your clinical background, clinical understanding about the given case scenario, and mainly justification for the selection of your outcome measure and treatment techniques 1 and 2. Why you have selected this outcome measure? You have to justify, depend on the problem the patient is facing and also the kind of treatment what you are giving. Based on that you have to justify for the outcome measure. Coming to treatment technique, you have to justify based on the problem the patient is having and the goal you have set. Accordingly you have to justify the treatment technique number 1 and number 2. This is what will basically mainly will be expected in the oral examination. That will be for 10 minutes. So totally you have 20 minutes of practical examination and 10 minutes of oral examination. So totally 30 minutes. And previously the first initial 10 minutes for preparation of your answer, that will not be included in the practical examination. It is your own task. You have planned it and accordingly you have performed it. That's it. The performance only will be taken into account. So mark is only going to be allotted for your performance and the oral examination, your viva answers. Based on that the mark will be allotted. So coming to PT Ortho mark, it will be 100%, calculated for 100%, and it will be converted to whatever percentage the appropriate subject needs later. So the examiner will be having a checklist. So the checklist will have various particulars, various aspects. Accordingly we will allot the mark. Okay, so those checklist also I will explain you in the next video sessions. Right now today's session is basically to introduce you and make you familiar with the PT Ortho practical examination structure, how it is going to be, so that you can mentally and practically prepare yourself. Okay, so there might be slight changes happen in the future. However, the ideal practical examination session structure will be like this only. So I want you to prepare yourself accordingly, so that your performance at the examination will be very efficient. As I already told you, the skills, the background information, background knowledge level, what are the things are necessary for practical examination. I hope you are all already engaging yourself in training yourself, practicing those skills at home. So along with this, based on this structure, you try to practice at home using some model at home, and that will be more helpful. Okay, with this I conclude this video discussion, and we'll meet later with another important aspect with the practical examination. Okay, have a nice day. Thank you very much.